Personal protective equipment must be worn by all clinic staff. The level and type of PPE that is worn will be appropriate to the role requirements of the staff member and in line with the government and public health recommendations. Every optical assistant, patient advisor, clinic manager and surgery team member must wear a surgical mask and a visor. The exception would be if there is a perspex screen between you and the patient. All surgeons, optometrists and anaesthetists must wear an FFP2 surgical mask, visor, gloves and an apron when undertaking an in-clinic patient consultation. The level and type of PPE required for each role is detailed within the COVID-19 Clinical Directive. To ensure the effective use of PPE, you must understand the correct procedure for donning and doffing PPE. Donning PPE. Use the approved technique to clean your hands with soap and water for at least 20 seconds. Put on a disposable apron. You can break the necktie so that the apron can be adjusted to fit. Tie the apron at the neck and at the waist, making sure both are securely tied. Put on your face mask. Ensure that the face mask is secure and is positioned flat against your cheek. With both hands, mould the nose piece by firmly pressing down around the bridge of the nose until you have a good fit. The surgical face mask must not dangle around your neck before and after use. It should not be touched after it is put on and must be immediately changed when it becomes moist or damaged. Put on eye protection. It is sufficient to wear either a dual eye shield or a visor. Put on disposable gloves. There is no requirement for double gloving. Following the correct process for doffing of PPE is essential to minimise the risk of self-contamination. Remove disposable gloves. Grasp the outside of the glove above the cuff and peel off. Hold the removed glove in the remaining gloved hand. Slide your fingers under the remaining gloved hand to touch the inside of it and peel the remaining glove over the first glove. Clean hands with hand sanitizer. Remove your disposable apron. Do not touch the front surface as it may be contaminated. Unfasten or break the neck and let the apron fall down on itself. Break the ties at the waist and fold the apron in on itself. Do not touch the outside of the apron. Remove eye protection. Hold both sides of the eye protection and then lift and pull away from the face, keeping your eyes closed. Clean hands with hand sanitizer. Remove your face mask by carefully pulling the ear loops outwards and the mask away from your face. Do not touch the outside of the face mask. For the effective use of PPE and to limit the spread of infection, always keep your hands away from your face and the PPE being worn. Change gloves if they are torn or heavily contaminated. Limit the surfaces touched in the patient environment and regularly perform hand hygiene. Any questions relating to the provision of PPE can be directed to ppe@opticalexpress.com.